Today topic of discussion is phenylalanine and tyrosine metabolism. We consider together because phenylalanine ultimately converted into tyrosine and the tyrosine gives glucose, fat and different specialized product. That's why it considered together. Metabolism first step, phenylalanine is converted into tyrosine. Another name of tyrosine is para-hydroxyphenylalanine. It is a irreversible reaction catalyzed by enzyme phenylalanine hydroxylase. In this reaction, two molecules of oxygen, one molecule of oxygen incorporated at para position of phenylalanine and get converted into tyrosine or para-hydroxyphenylalanine, and another molecule is converted into water molecule. This reaction depends on tetrahydrobiopterin. It is a coenzyme. Again, this tetrahydrobiopterin is converted into dihydrobiopterin. Again, the dihydrobiopterin regenerate with the help of NADPH, dependent biopterin reductase, and catalyzed by dihydrobiopterin reductase. So, phenylalanine is converted into tyrosine. Tyrosine other name is called as para-hydroxyphenylalanine. In this reaction, that one molecule of oxygen incorporated at the para position of phenylalanine and get converted into tyrosine, and another molecule is converted into water. In this reaction, depending on this tetrahydrobiopterin, it will converted into dihydrobiopterin. Again, this one is regenerated with the help of NADPH, dependent biopterin reductase. It is catalyzed by dihydrobiopterin reductase enzyme. It is a irreversible reaction catalyzed by phenylalanine hydroxylase enzyme. Suppose defect or lack of these enzymes leads to disorder that is known as phenylketonuria. Absence or lack of these enzymes leads to the disorder name is called as phenylketonuria. First disorder. This is the first step, tyrosine, that para-hydroxyphenylalanine in transamination is converted into para-hydroxyphenylpyruvate. It is a transamination reaction catalyzed by enzyme tyrosine transaminase. There is interconversion of alpha ketoglutarate is converted into glutamic acid. This one is the PLP dependent. Absence or lack of this enzyme tyrosine transaminase, this one leads to disorder that is known as tyrosinemia type 2. Absence or lack of this enzyme tyrosine transaminase lead to a disorder name is called as tyrosinemia type 2. Para-hydroxyphenylpyruvate is converted into homogentisate. In this reaction required vitamin C and copper dependent enzyme. This reaction is catalyzed by hydroxylase. So, para-hydroxyphenylpyruvate is converted into homogentisate acted upon enzyme hydroxylase. This reaction required vitamin C and copper dependent enzyme. Defect or block of this hydroxylase enzymes lead to disorder name is called neonatal tyrosinemia. So defect leads to disorder name is called neonatal tyrosinemia. This homogenicitate is converted into 4-malonyl acetoacetate acted upon enzyme homogenicitate oxidase. This reaction required oxygen molecules. So homogenicitate is converted into 4-malonyl acetoacetate acted upon enzyme homogenicitate oxidase. This reaction required oxygen molecules. Absence of or block or defect of this enzyme leads to disorder name is called as alkaptouria. This 4-malonyl acetoacetate undergoes isomerization reaction to form fumarate acetoacetate. With the help of enzyme malonyl acetoacetate isomerase, malonyl acetoacetate is converted into fumarate acetoacetate. Now this fumarate acetoacetate, here cleavage breakdown process will occur with the help of hydrolase enzyme, fumarate acetoacetate hydrolase enzyme. It will form fumarate and acetoacetate. This fumarate undergo TCA cycle and respond for generation of glucose. This fumarate is responsible for formation of glucose. This acetoacetate will give fat. This isomerase and hydrolase enzyme absent means it leads to disorder name is called as tyrosinemia type 1. So these both enzymes are absent. Absence means leads to disorder tyrosinemia type 1. So introduction part only we discussed phenylalanine is ultimately converted into tyrosine. It will give glucose, fat and some special product. So here it will give glucose and fat. What are the special product? It will give melanin, then it will synthesize dopamine, epinephrine. So what are the special product? It gives melanin on skin, eyes, then it is responsible for synthesis of dopamine in central nervous system, then in adrenal medulla it is responsible for synthesis of epinephrine and norepinephrine, then in thyroid gland it is responsible for synthesis of T3 and T4. These are the special product. So defect or block of this 5 different type of enzyme means it will causes inborn error metabolism. What are the inborn error metabolism? Type the 1, phenylalanine hydroxylase enzyme absent means it leads to phenylketonuria. Second enzyme tyrosine transaminase block means it leads to tyrosinemia type 2. Then hydroxylase enzyme absent means it leads to neonatal tyrosinemia. Then fourth one, that oxidase enzyme absent means alkaptouria. Then isomerase and hydrolase enzyme absent means tyrosinemia type 1. These are the inborn error metabolism of this phenylalanine and tyrosine metabolism. This one is the notes format. Phenylalanine is a essential amino acid Both are glucogenic and ketogenic in nature. It gives glucose and fat in their metabolism. So it have both glucogenic and ketogenic in nature. Thanks for watching.